Yellow Group B Correctives, San Joaquin Memorial High School Volleyball. First activity is upper body rolling that will be performed. Think about touching the lower ribs to hip to bone to help engage the core first. A muscle underneath, just medial on the stomach area, right above the hip bone, will bubble out. This muscle is called the iliacus muscle or transverse abdominis. Engage that muscle and then begin to perform the movement. Engage the core, lift the head, and then look with eyes and reach with the arm following to perform this activity correctly. The limbs that are not reaching will be reaching in opposite directions as shown and pointed out in this video. Don't use lower legs to help the roll, just use the upper body. No pushing into the ground of the lower legs will also be allowed. The arm above the head and leg on the same side, again, will reach in opposite directions at the same time while reaching across the body to perform the roll. The next activity is the hard roll for stability. This hard roll will be first performed with touching the elbow to knee and maintaining contact of the elbow to knee while performing this roll. The opposite limbs that are flat on the ground will be reaching in opposite directions apart from each other. Roll to the side using the head first. This is very important that the head and eyes lead the way. Switch sides and repeat to perform this activity. The core should be engaged very firmly to bring the knee to the elbow and keep the hip flexed and keep the body parts touching together. Breathing should also be maintained during this activity. If you are unable to touch the elbow to the knee, please use a ball, please use a block or a towel roll, any device or thing that could be used to put between the elbow and knee to decrease the amount of space that has to be reached across. Then push down on this object to roll in the same fashion that was described earlier. Try not to use momentum or push the arm to roll over. Use the core and head to rotate the body. This is a timing exercise. A ball could also be used as a device or object to perform this activity and fulfill it correctly. The objective of the activity is to engage the core and then utilize the head to move the rest of the body in the direction that is desired. Always maintain breathing, always maintain a relaxed face, and keep the core engaged at all times. This activity must be stopped before compensation occurs, before fatigue occurs, and should be done without any pain. If pain is felt, please stop this activity, or if fatigue is felt, please stop this activity and move on to the next corrective exercise. Next activity is a dead bug activity. This activity is performed lying on your back. Bring your knees and feet up into the air and begin to perform opposite pattern, cross-patterning movements. Only reach out as far as you can, maintain the hips and low back on the ground level. Keep a relaxed face, deep diaphragmatic breathing, and mindfulness and focus of the posture of this position. Perform this activity slow. When performed slow with all the things just listed, the student athlete may progress. A progression would be to straighten out the legs with the bottom of the feet towards the ceiling. The regression would be with a bent knee, touching the elbow, touching the hand to the knee. Next corrective activity is the plank/beast. The plank activity is performed in a push-up position. First thing that needs to happen is engagement of the core, just like what was performed in the last activities. After the core is engaged, drive and push the hands into the ground. Push back towards the feet with the hands. Drive the feet into the ground and push towards the hands. Both the forces will meet in the core hip area, and that will help engage the core to make it fire. Once the core is engaged and firing, flex the hip of one leg, bringing the knee to the chest. While this is happening and sides are alternating, The leg that is down with the foot on the ground must continue to push firmly into the ground to maintain action of the core. Another thing is hyperextension of the elbows. Prevent hyperextension of the elbows like it is shown in the video. Keep the elbows slightly bent. Utilize the muscles. Don't rely on the tendons and ligaments of the joints to support you. After the elbows are slightly bent, drive them into the ground and perform the activity as listed. It's important as well to prevent swaying from side to side. The point of this drill is to stop the sway and improve stability, not to sway side to side. Don't move the body in a different way to compensate and make the exercise easier. This is a compensation and does no good. Next corrective exercise is the side plank activity. The side plank will be performed on the knees initially. Reaching could be a progression of this activity in all directions. The eyes will follow the hand or move in opposite directions of the hand to change it up and challenge the neurological system. There are many progressions that can be applied to this position or activity. Rotations, head and cervical nods and rotations. Progress only when the patient is able to have a relaxed face and diaphragmatic breathe in these positions. The arm can also be loaded with weight as another progression. Internal and external rotation of the hip can also be progressed. Push the knee down to the ground to lift the top leg up while having the arm up. Add head movements and breaths as well to continue the progression. When transitioning, sit back and then flex the hip to transition to the next move. The next activity will be performed chops. Using a band of any resistance to perform the exercise is necessary. Another band would be put to good use like the band showed in the video. Tying the band to the door or using another person to help for assistance would be important. The first thing that needs to be maintained is level hips, maintaining good posture from side to side, as well as maintaining good posture of not being too far forward or too far back, as is displayed in this video. Centration of the hip is very important and key for awakening the stabilizers of the hip, which will give a firm support of base to improve rotational power. Tucked chin, tall head, tall spine, and level hips. Once those are achieved, grab the band and prepare to chop while maintaining this posture in a rotational plane. Grip with both palms facing downward on the band. Engage the core again, thinking hip to rib, and maintain this posture while rotating, maintaining braced core to keep this posture. After pressing the band to the ground as shown in the video, pull the hands apart at the bottom. Bring the hands back together, back to the chest, and rotate back up to the top to perform 1 rep of the chop exercise. The return is also slow. All aspects of this exercise should be performed slow with deep diaphragmatic breathing, a relaxed face, and mindfulness of the posture and body awareness in space. Moving the front leg further outside is a regression. Move the foot further in as a progression when confident and able to maintain this posture. The next activity will be lifts. Chops go with lifts. The lift can also be done with a band that should be tied at a low level. The same routine will happen. Level the hips, engage the core, and then begin to perform the move or the lift. The challenge of the exercise is to maintain the posture during this rotational activity. Maintain level hips. Don't let the ribs flare out or the back hyperextend. Breathing, core engage, and head turning should also all be performed and thought of with mindfulness during this activity. In the video is a view from the backside of how this looks.